Good morning, everyone. Today is the first class with me, right? So, my name is Dr.Joenna, and today I'm going to take your class on levels of prevention. Okay, we'll start the class. It's a very important class, most commonly asked. Every one of you should know it. Okay, so today's class is on interventions at each level of prevention with examples. So, what are the strategies of prevention? Prevention, you know. Prevention means like before the occurrence of a disease or before the appearance of a risk factor. In order to prevent such diseases or prevention, what are the steps, what are the activities a person has to take up? Those falls under the levels of prevention. So have you any classes on natural history of disease has been taken or not? Yes, roll number 1, are you present? Taken. Okay, so if it is taken, then you must have known the stages or the levels of stages of the how a disease progresses. Okay, so these levels of prevention. Why I am saying that natural history of a disease, because this prevention, with the different types of prevention we are going to take, will be based upon that different steps of the natural history of disease. That is why we need to know the natural history of disease first thing. Okay, so now let's start with this strategies of prevention. So strategies means the activities, the planning which we are going to take in the prevention. So there are two major kind of strategies. That is, one is population strategy and another one is high risk strategy. Okay, so under population strategy, what it means is that when we apply the particular technique or the activity for prevention, it is applied to the whole of the given population. Okay, irrespective of any other depending factors, it is applied to whole of the given population. So for example, like if it is in the medical institute, okay, if it is in the medical institute, then whoever is belonging to the medical institute, whether it may be the faculty, the staff, students, they are advised, they are taught how the hand hygiene practices, it is being taught to all the people who are belonging to the medical institute, because hand hygiene is very important in order to prevent cross infection. So it is not only by the doctors or not only by a particular group of people belonging to the medical institute, but it is to all those people who are belonging to a medical institute. Hand hygiene practice, it is one of the example of population strategy. Okay, then another one is providing the iodized salt in the public distribution system for reducing the deficiency of iodine. So you must have heard in your locality, in every places of India, you must have seen that people are going and they have this ration card, and they can go and they can buy rice, dal, then this salt, this basic needs, basic food items. It can be bought at a cheaper rate. So have you come across this or not? That they have this ration card, and with that card, you can buy this rice at a very cheap rate. Like per kg, you can buy at 4 or 5 rupees, like that, which is given by the government. That is known as public distribution system. Have you come across this or not? Public distribution system. Have you come aware? Have you come anytime, like in your locality or in the newspaper, or in any form of media, you must have heard that the government is providing at a cheaper rate the rice at only rupees 4 per kg, like that. Those who have the card, like that. So in that public distribution system, the salt packet which is being provided to the community, that is iodized form of salt. And why we are giving this iodized form of salt? In order to reduce the deficiency of iodine. So it is irrespective of the age, gender, or the community, okay, where they belong to, but to all the people of the nation, it is iodized salt is being provided. So to the whole of the population. So this is one of the example of population strategy. Now coming to high risk strategy. What happens in high risk strategy is that such kind of technique or the activities will be applied only to a certain group of population, only to a specified group. For example, hepatitis B vaccine will be given to all the healthcare workers. Okay, so why? Because they are at the higher risk of getting this infection while they are handling the patients, or while they are handling any of the these tissues or any of the fomites. Okay, fomites means anything. When they are handling these things, they are at the prone of getting the chances of infection. Then another example is like veterinary doctors. They are supposed to be given anti-rabies vaccine, particularly, especially to all the veterinary doctors, because they're always at the higher risk of getting this rabies disease, right? So now what I want to know is, in your class, how many of you have taken hepatitis B vaccine? Yes, roll number 1. Have you taken a hepatitis B vaccine? You have taken or not?
In my childhood, in my birthplace.
In the childhood, that immunization schedule, you mean? Not that one. When you become an adult, after that you took it. You took it or not? The hepatitis B vaccine.
I'm not sure, but I think I have taken.
Okay, you please ask your parents whether you have taken the vaccine or not. If you have not taken, not the immunization schedule one, that immunization schedule one is just to prevent the perinatal transmission, mother to child transmission. Okay, that one is not in that one suffice. That is not enough. So we all have to take. Says, and if you have not taken, you ask your parents. If you have not taken, then you have to take it. Yes, roll number 2, you have taken or not? Absent. Roll number 2 is absent. Okay, 2 is absent. 3. Roll number 3.
No, ma'am.
You have not taken. Okay. 4. Have you taken?
Ma'am, I'm not sure, but I
Okay.
think I have taken.
You have taken or not? You are not sure. 5. Have you taken? 5.
Sure.
Not sure. 6. 6 is absent. 7. Roll number 7. 7 is absent. 8.
No, ma'am.
Okay, roll number 7.
7.
You are 7. So have you taken the vaccine or not?
Yes, ma'am, I've taken.
How many doses you have taken? How many times you have been vaccinated?
Yes, I've taken, ma'am.
Yes, I know you have taken. How many times you have taken the injection?
The first dose.
The first dose, when did you take? When was it?
1 month back.
1 month back. Where did you
1
take?
month back, ma'am.
Where did you take? In NEIGRIMS?
Okay, in NEIGRIMS.
Where? Which department you went
Yeah.
and you took? Can you tell so that your friends will be aware of it since you took? Yes, 7. Roll number 7, what is your name? Ankita. 7. 7 is Ankita. Am I audible to you all or not? Right now?
Yes, ma'am.
So why I am telling you regarding this high risk strategy, giving the example of
Yes,
hepatitis.
ma'am.
Yes. Yes,
Yes,
Ankita.
ma'am.
Internet is poor. Okay, now, so why I am telling you regarding the hepatitis B vaccine as the high risk strategy, because you all are at high risk for getting this hepatitis B infection. Understood? So each and every one of you need to take the hepatitis B vaccine. All right? So if you have not taken, please take it. Okay? So it will be taken in how many doses? You will take 3 times. Okay, first time, say suppose you took it today, then after 1 month you will take the second dose, and after 6 months you will take the booster dose. Like this you have to take it. The one which is taken at the birth, it is just at the birth time, and it is the reason behind taking that immunization schedule, that hepatitis B, is just to prevent the perinatal transmission. That one is not enough. Okay, so since you belong to the healthcare worker, we all need to take this vaccine compulsorily. That is why I am telling high risk strategy. Example is this one. Okay, then next we will come to the levels of prevention. So coming to the levels of prevention, we have 4 kinds of levels of prevention. Okay, those are primordial, primary, secondary, and tertiary. Okay, 4 are there. So considering the point of time when the intervention is applied, okay, for halting the occurrence or progression of the disease or its risk factor, we have these different levels of prevention. So based upon the time when we apply that particular intervention, it is divided. All right, so we will see one by one. Okay, coming to the primordial prevention, first one, when do we apply this? This kind of primordial prevention, it is applied when the risk factor, okay, the prevention of initiation or progression of risk factor where it has not yet appeared. That means before the risk factor appears, if you apply the prevention method, we call it primordial prevention. Before the risk factor appears, I repeat again, before the risk factor appears, if you apply that particular activity for prevention, we call it primordial prevention. Understood? So if you are asked to give an example of the primordial prevention, like in the school children, we are teaching to the school children that what are the bad habits, like smoking is a bad habit, drinking alcohol is a bad habit. So we are making them aware from such a young age. Okay, So this is one of the example of primordial prevention. Primordial prevention from the NCDs. Okay? Primordial prevention from the NCDs. Yes, roll number 8. Are you there?
Yes, ma'am.
Okay, so roll number 8, NCDs. I have said NCDs. Here, primordial prevention is applied for one of the example I have given is that educating the school children about the smoking and the alcohol, that it is a bad habit at such a young age in order to prevent NCDs. What does NCD stand for? Have you heard of the word capital N, capital C, capital D, small s, NCDs? What is the full form?
No,
Googling?
ma'am.
Okay. Roll number 9.
Non-communicable disease, ma'am.
Oh, okay. Let's continue. Yes, somebody has told rightly. I think roll number 9. You are the one or what? Like
No, ma'am. No, ma'am. I told it.
who? Roll number 8. Okay, okay. Roll number 8, you told that NCD stand for non-communicable disease. Very good. Non-communicable disease. Roll number 9. Are you there?
Yes, ma'am.
Okay. Roll number 9. Can you give one example of NCD?
Ma'am, diabetes.
Very good. So diabetes, hypertension, okay, cardiovascular
Yes,
diseases,
ma'am.
these are example of non-communicable diseases. So we know that children, they are not at the risk. They are at young age. At young age, they are not at risk of developing this hypertension or cardiovascular diseases or diabetes. Diabetes, I mean the not the genetic one, but the type 2 type of diabetes. They are not at risk when they are children, when they are at the stage of being a children. So what happens is that if we make them aware of this smoking, alcohol, their bad habits from that time onwards, then such kind of prevention is called primordial prevention. I hope everyone is clear. Similarly, teaching yoga meditation to the young children, okay, to the young children, so that their mental health is good, okay, they know they keep their mental health good. As you know, as we grow older, our responsibility increases. As our responsibility increases, what happens? Mental health diseases, mental health is also mental diseases, mental disorders, these are also NCDs, okay. So what happens? Mental disorders like depression, anxiety, this kind increases. So another thing is even hypertension is also increased. So if from the very young age onwards, if we teach them yoga, meditation, then what happens? Then they can, this kind of prevention which we apply at this stage, we call it primordial prevention, okay. So if we apply at such a young age, then the incidence of such diseases will be decreased, okay. So that is why it is known as primordial prevention, okay. Next we will go to primary prevention. So second one is primary prevention, the efforts or interventions done before commencement of the disease. Here what happens is that already the risk factor is there, okay, risk factor is there, but the disease is not there, okay, risk factor present, disease not present, but if you give certain intervention at that stage, we call it primary prevention. In primordial prevention, what happens? Yes, roll number 10. Are you there? Roll number 10. Okay, you are not there. Marked absent. 11. Roll number 11.
Yes, ma'am.
Okay, as I told already, in primordial prevention, which level we applied that kind of prevention? Before?
Before the disease happened, occurred.
No. Before the disease happened is for the primary prevention. I asked for the primordial prevention. When do we apply? Before?
Before the risks happen.
Yes, you are right. So you are roll number 11.
Yes, ma'am.
Okay, so 11 has rightly told that before the risk factor happens, if we apply the prevention or the intervention, we call it primordial. So already the second one is risk factor is there, but the disease is not there. That time we call it primary prevention. Okay, so that is what is known as primary prevention. So for example, like giving measles vaccine to the infants. We all know that infants, they are already at the risk of developing the measles after 6 months, okay. At 9 months we give measles vaccine to the infants, to all the infants, okay, under the NIS stands for National Immunization Schedule. So what happens is that because the infants, they are all at risk for developing this measles, that is why we are giving at 9 months measles vaccine. Now you all know that COVID pandemic is happening and we are wearing PPE. personal protective equipment. Okay, we are wearing PPE, we are wearing mask. Okay, we are wearing mask, gloves. Okay, before handling any infected person, or even while going out also we are wearing mask nowadays, because already we are exposing to the risk. The risk is there. That is why risk is there, but the disease is not there, right? The disease is not there, risk is there, and we are wearing all this PPE, mask, gloves. These are example of primary prevention. So you can be asked in exam, you will be wearing you will be wearing mask. Which level of prevention is that? You have to tell primary prevention. Vaccination, which level of prevention is that? That is primary prevention. Have you taken COVID vaccine? Roll number 12. Are you there?
Yes, ma'am.
Okay. Have you taken vaccine, COVID vaccine?
Yes, ma'am.
Okay. That COVID vaccine belongs to which level of prevention?
Primary.
Why? Can you explain? Why do you say it is primary, not primordial? Yes, yes. No problem. If it is wrong also, I will correct you. You try.
Because we took the vaccine
We took the vaccine because
to prevent ourselves from getting COVID.
to prevent ourselves from getting
Before we
COVID.
even get the disease.
Pardon, 12. Can you repeat once again?
We took the vaccine to prevent ourselves from getting the disease.
From from getting the disease or the virus infection, we are getting the vaccine. So prior to getting the disease, but the risk factor is already there, right? 12. What is your name? Roll number 12.
Bathsheba.
Bathsheban. Am I pronouncing it correctly?
Bathsheba.
Bathsheba.
Yes, ma'am.
Okay, Bathsheba, you have told it correctly. Like, you have taken the vaccine to prevent the occurrence of the disease, but the risk factor is already there. That is why it is primary level of prevention. So you can be asked in Viva, vaccination is which level of prevention? Your answer should be primary. I hope everyone is clear. Let's go to the next one. Primary, two interventions in the primary prevention. Very, very important. When you are asked primary prevention, what are the interventions in the primary prevention? Everyone should answer health promotion, number 1, specific protection, number 2. These are the two interventions, okay? Health promotion, specific protection, okay? Okay. So now, when we are asked what is health promotion, okay? Health promotion, these are the examples of health promotion which I have given here. Like, we are having proper road with adequate transport facilities if it is available, public transport facilities if it is available with proper road condition, then their chances of getting the road traffic accident is reduced, right? This is an example of health promotion. Adequately ventilated houses. If the ventilation of the houses, later on in your coming semester you will learn about how to calculate whether the ventilation is adequate or inadequate in a house. Okay, so ventilation if it is adequate, then it reduces the chances of respiratory infection. Okay, yes. Roll number 13. 13,
Yes,
are you
ma'am.
there? Yes.
Yes, ma'am.
Respiratory infection which is reduced if there is adequate ventilation. Can you name one respiratory infection which will be reduced if there is adequate ventilation? Or name one respiratory infection which has higher chances of getting infection among the family members if the ventilation is inadequate. Can you name one respiratory infection?
Um, just like TBs.
Very good. TB, tuberculosis, is highly infectious. Okay, very, very infectious. So what happens if the ventilation of the house is not proper, and if one of the family member is getting infected with TB, what happens? The rest of the family members, the chances of getting the infection is very high. Okay, that is why adequate ventilation, if it is made while making the house, if you make adequate ventilation, that is one example of health promotion. Okay, another one is if the safe drinking water is available to the community, then what happens? Diarrheal diseases, worm infestation, these are all reduced. Understood? This is one of the example of health promotion. Okay, so I hope you all will be able to give example of health promotion. Next, coming to specific protection. This is another intervention in the primary level. Okay, so under this, what happens is that preventing the disease by specific intervention. Here it will be focusing on the specific area, like how we have already told, this vaccination, pre or post exposure prophylaxis. Okay, And while you are driving, we wear seat belts, we have a speed limit, you can't cross over 90 kilometer per hour like that. Then we wear helmet when we go by two-wheelers, then and keeping our body weight within the normal limit, not overweight or obesity. Okay, these are specific protections. Example, understood? Okay. Next, coming to secondary prevention, secondary level of prevention. Here, what happens is that actions which halt the progress of a disease as early as possible so that the complication and adverse outcomes can be minimized. So what happens is that in the primary level, we already learned that the interventions which we are going to give is before the disease happens, but already the risk factors are there. Okay, and in secondary level of prevention, what happens is that the disease is there. Okay, the disease is there, but we want to give the intervention so that the progression of the disease will be stopped. Okay, so that complications of the disease or the adverse outcome of the disease does not happen. Understood? That is what is meant by secondary prevention. For example, screening of diseases. Okay, screening of diseases, example, like if in a community, in your community, if we go today and if we measure the blood pressure of all those adults who are 40 years and above, for example, every house to house we will go 40 years and above. If we measure the blood pressure of all those adults 40 years and above, and then in a community, then we will find that some of them will be hypertensive, but the thing is that they were not aware of their situation before. Okay, they were not under medication. Already hypertensive patient, okay, no problem, but there will be some individuals, of course, definitely there will be some individuals, what happened, some individuals that they were not aware that their blood pressure is high. Okay, because they were not symptomatic, they were not showing any symptoms, but because of your screening activity, they got to know their condition. Okay, so this is one of the example of secondary prevention, secondary level of prevention. So it can be screening of hypertension, screening of diabetes, okay, screening for cervical carcinoma. These are examples of secondary prevention. Okay, so that their conditions are detected at the early stage. Okay, thereby preventing the progression of the disease, because complications of hypertension, you know, stroke can happen. Okay, stroke, then cardiovascular accidents, which comes under stroke, then cardiovascular diseases. This can be the complications because of hypertension. So if you are making the person aware at an early stage and they are taking their medication properly, then they can keep their BP under control, and the further complications or adverse outcome can be prevented. Understood? That is why secondary prevention, secondary level of prevention is applied when the disease is there, but we are preventing the progression of the disease. Okay, so if you are asked screening of a disease, which level of prevention, your answer should be secondary level of prevention. Understood? Okay, so surveillance is one of the very important activity which helps in the application of the secondary prevention. Okay, so if you are asked to define what is surveillance, then it means continuous scrutiny of the factors that determine the occurrence and spread of disease and other conditions of ill health which are pertinent of effective control. So surveillance means continuous scrutiny. You know about CCTV camera, which is fixed everywhere. So CCTV camera is like, what is the activity of that camera? Continuous scrutiny is happening. Okay, continuous scrutiny. Likewise, surveillance is done. So by surveillance, we mean continuous scrutiny of the factors. Okay, those factors which help in the occurrence of the disease or the ill health, so that if we get to know all those factors which is contributing to the happening of the disease, then we can give the proper effective control method. That is what is meant by secondary prevention. Okay. Okay. Next, come to tertiary prevention. When we talk about tertiary prevention, it happens that all the measures to reduce or limit the impairment and disability to promote the patient's adjustment to irremediable conditions. So what happens is that here the disease has already progressed a bit. Okay, so what we want is, we want to reduce or to limit the impairment or the disability which is caused by the disease. Say suppose a person has hypertension, and because of that hypertension, the person develops stroke. That is a complication, right? So now he has developed stroke. So what we are going to do is we are going to apply tertiary level of prevention. What happens in tertiary level of prevention is that since the person is suffered from stroke, the person will be paralyzed. Okay, paralyzed like hemiparalysis or whatever. Okay, like left-sided paralysis is there. Left side of the body is paralyzed because of the stroke, for example. Now, since he is not able to move, that means he is not able to move, impairment or disability. So we want that impairment or disability to be reduced. So what we will do, we will go for physiotherapy and all. Okay, so that kind of physiotherapy and all will come under the tertiary prevention. Understood? This is the example. Okay, so here what happens is that tertiary prevention, it focuses on preventing the complications or the adverse effect among the people already suffering from the disease. They are already suffering from the disease, but we want their complications to be reduced. That is what is meant by tertiary level. Like for example, person suffering from leprosy. Okay, so their limbs will be disabled, for example, if it progresses. Okay, so that time what we do is we will give them physiotherapy or like artificial limbs or whatever if it is amputated and all following accidents or disaster. Okay, that will come under the tertiary prevention. Okay, and disability limitation and rehabilitation, these are the types of intervention in the tertiary level. Okay, this is about tertiary prevention. Now here we have come across these terms, impairments, which causes impairments or disabilities, and disabilities. Impairment has different meaning, disabilities have different meaning. We will come to that. Okay, so what you have to remember here is that when you are asked to mention the intervention in primary level, you have to tell health promotion, specific protection. You have to know the example of health promotion, specific protection in case of primary level. Okay, and in case of secondary level, secondary prevention, progression of disease as early as possible. Okay, then in tertiary prevention, what we have to do, disability limitation and rehabilitation, very important. This is the intervention. Okay, in case of tertiary prevention. Now let's come to this example, impairment. When we say impairment means any loss or abnormality in, it may be psychological, physiological or anatomical structure or function. We call it impairment. Okay, if there is loss in the psychological, physiological or anatomical. Disability, by word disability we mean any restriction or lack of ability to perform an activity within range considered normal for a human being. It is considered normal for a human being, but the person is not able to perform, lack of ability to perform because of the impairment. That is known as disability. So if you are asked what is meaning of handicap, then disadvantages resulting from the impairment or disability which led to the disadvantage of that particular person. Okay, in the which is considered normal for that particular individual, considering the age, sex, social and cultural factors, we call it handicap. So for example, a person met an accident. Okay, because of that accident, a driver, okay, a truck driver met an accident. He is a driver by profession. Okay, he met accident and he lost one of the limb. Okay, lower limb, one of the lower limb. So it is an example, losing one of the lower limb. What do we call it? 14, are you there? Roll number 14. Roll number 14. Absent? 15? 15, roll number 15.
Yes, ma'am.
Okay, 15. I have given a scenario. Have you heard? Have you listened? Should I repeat again?
Can you
Okay,
repeat, ma'am?
I will repeat again. Okay, for 15, I'm repeating. A truck driver met an accident. He lost one of his lower limb. Okay, losing one of the lower limb is known as what out of these three? Losing a lower limb is known as disability, handicap or impairment. Which one will you choose?
Handicap.
No. Okay, 15, it is wrong. It's okay if it is wrong, because during the class time, please listen carefully. And another thing is, when you make mistake here, no problem, I am here to correct for you all. But during the exam time, we won't be there to correct you. So you make the mistake as much as possible here, but do not make the mistake during the exam time. I repeat again for all of you, impairment means loss or abnormality of psychological, okay, lost. you lost, or if there is any abnormality in the psychological, physiological, or anatomical structure, we call it impairment. Understood, 15?
Yes, ma'am.
Okay. Disability means restriction or lack of ability of performing an activity. Lack of performing an activity because of the impairment, because of the loss, is called disability. Okay. Handicap means the disadvantage which is caused because of either the impairment of this disability, which is considered to be normal for that particular individual. If we consider that he should be able to perform but he is not able to perform, that is, we call it handicap. So here I have given a scenario that a truck driver met an accident and he lost one of his lower limb. So if I ask losing of the one of the lower limb is an example of impairment. Okay, anatomical structure, loss of anatomical structure. Understood, 15?
Yes, ma'am.
Okay, so now because of the loss of the limb, okay, one of the lower limb, he is not able to go to toilet alone. Okay, he is not able to go to toilet alone. So it is an example of what? 15. Yes, 15. Are you were yes. I told that he lost one of his limb. Losing one of the limb is a loss of anatomical structure. So if you are asked losing of limb, it is known as impairment. Understood?
Yes, ma'am.
He, because of the loss of the limb, he is not able to go to toilet alone. Otherwise, what happens? For a normal human being, he was supposed to go to he was supposed to be able to perform that activity of going to toilet alone, right? But because of the loss of the limb, he is not able to perform that activity, particular activity, which is considered normal. Okay?
Yes, ma'am.
So that is known as what?
Disability.
Very good. That is known as disability. So now he is not able to perform his daily activity like going to toilet alone because of the loss of limb. So that is disability. Now 15. You are 15, right?
Yes, ma'am.
Okay. Yes, roll number 50, 50. Are you there?
Yes, ma'am.
Okay, 50. I told that this person is a truck driver. Understood? Yes, 50. You have heard?
Yes, ma'am.
He was a truck driver. He lost his limb in an accident. Now he is not able to perform his occupation as a driver now. Okay, because of the loss of the lower limb, he lost his job. Okay, that is known as what out of this three? Yes, 50. What do you think? He lost his job as a driver.
Handicap, ma'am.
Yes, handicap. Disadvantage. Why you are saying 50? Why you are saying it is non loss of the job as a driver is known as handicap?
Handicap.
Yes, I understood handicap. Why? 50? Why?
Handicap, ma'am.
Yeah, why 50? Why handicap? Why you are saying it is handicap and not disability? Why you are saying that loss of job as a driver is not disability but handicap? Why? Yes, roll number 15. Why you said that you losing of the not able to go to toilet himself is a disability, not a handicap? Yes, roll number 15. I'm asking to you also, and 50. I'm asking to you also. Two different questions.
Uh,
Yes,
be-
15.
yeah,
Why it is known as disability? Not able to go to toilet is a disability, but not handicap.
because uh, it cannot go to the toilet because it lack of ability to perform that activity to go to the toilet.
He is not able to perform the activity of going to toilet because of the loss of limb. So what is the difference with 50 saying that it is handicap when he loses job? What is the difference?
Because in handicap, it cannot fulfill his role or his role.
Yes, 50. You have anything to say? The question I asked 50. Why you said that loss of a job is a handicap, is known as handicap and not disability? Okay, so please listen carefully. I will explain, okay, the difference. He lost his limb, so he's not able to go to toilet. That means there is lack of ability to perform an activity within a range considered normal for a human being. Means it is a basic need. Going to a toilet is a basic need which he is not able to perform. So being a basic need, he is not that is not able to perform by that particular individual because of the loss of the limb. That is why it is known as disability. Okay? Now, losing the job as a driver because of the loss of limb is a disadvantage resulting from the impairment or disability that prevents fulfillment of a role. This is the answer fulfillment of a role. Okay, fulfillment of a role that is considered normal for that individual. So we know that he is a male, he is an adult, not an old age. Okay, and by profession, the social and cultural factor, this is okay. It is applied to certain conditions. So we know that as an adult male he should be and he is performing a role in the he is performing a role as a driver, but he lost that role as a driver. Okay, that is why it is known as handicap. Okay, one is basic need, that is going to toilet is a basic need, that is why we say it is disability. And if we are talking about the job, then we mean handicap. Okay, understood? For example, he was not a driver. For example, he was just a typist. Okay, computer typist, for example. Okay, what happens is that a person who is a computer this typist, he met an accident and he lost his lower limb. Okay, so losing the lower limb is an impairment. Understood? And not able to go to toilet is a disability, but he has not lost his role as a typist because he lost his lower limb. He can still type with his hands, right? So there is no handicap in that case, in that scenario. Understood 1550?
Yes, ma'am.
Okay, so this is the difference. So now let's see, these are the example. Okay, disease or disorder will be there. Sorry, impairment spelling is wrong. Impairment, disability, handicap. Okay, so if the disease is polio, for example, polio causes paralysis, impairment. Paralysis is the impairment. Understood? So because of that paralysis, the person is not able to perform the daily activity, that is limited mobility, that is the disability, that will belong to the disability. Okay, now the person being paralyzed limits his mobility, whether it may be the upper limb or the lower limb. Now there is limitation in finding the employment. Okay, there is limitation in finding the employment, that is known as handicap. Say suppose both the upper limb and the lower limb are paralyzed or movement is limited, but he is a singer, for example, singer, then still there will be no handicap. Okay, but the thing is that the finding the employment has been reduced, which employment where the hands and the legs are required, that he cannot do because of the disease polio, right? So this is an example. So let's see the another example, facial disfigurement. If there is facial disfigurement, then what happens? It limits the ability for social interaction. Okay, while coming out in the because of the facial disability, the person feels a little, the social interaction of that particular person will be reduced. So that will come under handicap. This is an example. Understood? Okay, let's come to the rehabilitation. Rehabilitation. So this rehabilitation is an intervention in which level of prevention? 49? 49, 49. Are you there? Yes, 49.
Primary.
Primary. Very, very wrong if you say it is primary. The things which I have taught from the very beginning
Also
is all lost. If
secondary.
you say it is primary, still if you say it is secondary, it is very, very wrong. You didn't understand anything. You are left with primordial and tertiary now. Yes, 49?
Yes, ma'am.
Yes, rehabilitation, which level of intervention? Is an intervention at which level of prevention? You don't know? 48?
It's tertiary.
Yes, who is answering tertiary? 49 or 48?
49.
49, it is tertiary. Okay,
Yes.
so I think you are having confusion. When do we give primary? What are the interventions at primary level?
Primary. Uh, when there is risk factor but no diseases.
Yes, very good. Risk factor is there, no disease. And the two types of intervention we give in primary is known as
Primary.
we call it, I have told two types of intervention, health promotion and specific protection. Okay, you have clearly defined
Yes.
risk factor is there, disease is not there. So the type of intervention, we call it health promotion, specific protection. Understood? 49?
Yes, ma'am.
Okay, and in tertiary, the types of intervention, what we are tertiary, when do we give tertiary level of prevention?
No. When there is diseases to prevent it.
When there is diseases, so what you want to prevent?
Do not let the disease to be like increase
And cause, increase and cause what? Complications?
and cause complication and all.
Yeah.
Yeah.
Yes, complication or adverse events following the disease. So to prevent that complications, okay, so that is known as tertiary. So one of the intervention at tertiary level is this rehabilitation. Understood? Okay, 49. Here I have said
Yes, ma'am.
nicely. See? Okay. See, have you seen here disability limitation and rehabilitation? This is the intervention. Understood? Okay, now let's come to rehabilitation.
Yes, ma'am.
So rehabilitation is specific scientific method in order to help the person to recover. Okay, disability means it can be congenital or acquired type of disability. So what we do is we will give this rehabilitation method. Okay, these are the types of rehabilitation. It is there in the book: neurological, cardiac, this drug or alcohol, physical, vocational, community, palliative. Understood? These are the types. You please read it. Okay, levels of prevention. This is the slide. I will share it later. Now what you have to do is, every one of you, you please copy these 2 questions for 5 marks each and send me here in this mail. Understood? Done? Thank you so much.